Hi, this is Dr. Tom Rogers coming to you with the weekly podcast, The Common Sense MD. That's me. Today I want to talk about something that has frequently been on my mind recently because I'm going to give a presentation along with a more esteemed colleague in front of the U.S. Senate committees. So while I was studying up and brushing up on this stuff, I thought I would just go ahead and make a podcast out of it. And what we're going to talk about really is cancer screenings. And that's very important because cancer, of course, is the second leading cause of death right behind heart disease. And I will say, being a preventive doctor, that I like to emphasize prevention. And with cancer screening, what we call primary prevention is basically lifestyle, which is what I preach all the time as far as nutrition. Think obesity, other risk factors like tobacco, alcohol, sunburns. Notice I didn't say sun, I said sunburns. Go to my previous podcast on skin cancer. And chemical and hormonal exposures. Those are all risk factors, and they're primarily the thing you want to do to prevent cancer. Secondary cancer prevention is where we talk about the screening tests that we use to pick up an early cancer before you're going to notice it. Of course, I'll preface this whole thing by saying that if you notice a change in something, i.e., a lump in your breast or testicle or a dark spot on your skin, or if you're coughing up blood, pooping blood, of course you need to get that checked out. We're talking about asymptomatic screening for cancer prevention. And I want to choose the top 4 cancer killers and focus on them as all we would be doing in front of the Senate committee. But so this is important stuff because there's a lot of controversy about, when and how often you should be screened for cancer. It's kind of become controversial because a lot of governmental and insurance companies try to poke their heads into it and, determine whether it's worth it or not. And this is going to be more from a common sense thing that I've observed and I think that are important in my patients. So there's, the American Cancer Society, their recommendations may be different than the U.S. Preventive Health Force Task, because what they look at a lot of times is cost benefit, if it's worth it to do it or not in the long run. So I look at it from the perspective of I want to keep all my patients healthy. I don't care if you're 40 years old or 80 years old. I really want you to be healthy and assume that you're going to live for a long, long time and live a good lifestyle, healthy lifestyle, what we call lifespan, or health span, not lifespan. So secondary prevention of cancer with screenings. As you know, the most commonly diagnosed cancer is skin cancer. So we're not going to talk on that really much today because you certainly want to look out for melanomas. They're not nearly as common as squamous or basal cell. So the most commonly diagnosed cancer is skin cancer, but I'm not going to really focus on that. You obviously need a skin check, and if something's different on your skin, you need it checked out by a doctor. But I'm mostly going to focus on the most common types of killers. Of course, lung cancer is the top killer. The most commonly diagnosed cancer is breast cancer, and then prostate cancer, and combined for men and women, it's colorectal cancer. So we'll be focusing really on these 4 types of cancer. Let's go ahead and talk about lung cancer first, since it's the major killer cancer, most common killer cancer. And interestingly enough, as the rate of cigarette smoking goes down, the rates of lung cancer go down. So obviously, you don't need to be smoking. And there's different recommendations, but And we have kind of a new way to screen for lung cancer. Typically, chest x-rays weren't very good at detecting lung cancer. Now we have low-dose radiation CAT scans for cancer. And certainly, if you're at risk for lung cancer, like you're a smoker, you need to start, I think, getting a baseline probably at age 50 all the way up to 80. In other words, if you're a smoker at 50, you need to get one of these low-dose CAT scans of your lungs. And certainly sooner if you've been smoking for a long time. If you have a 15 to 20 pack year history, you need to start screening way before then. Probably my recommendation is age 40. And if you continue to smoke and haven't quit within the last 15 years, this is a yearly test for you. They can cure lung cancer if they get it early enough. Previously, it was hardly curable, but they can. And remember, these cancers I'm talking about are all slow-growing cancers. So if you get them early enough, you can cure the cancer. And maybe it'll talk you out of smoking. So lung cancer, baseline CAT scan of your lung at age 40 to 50, sooner if you have, the earlier, the more smoking history you have, and certainly if you have risk factors like asbestos exposure, etc., or if you'd worked in the coal mines. But so that's kind of a new tool that we're doing. Not a whole lot else to say about that, unless you're symptomatic. Let's talk about colon cancer. They've just recently changed the guidelines so that you should get a baseline colonoscopy at age 45 instead of 50. That's pretty much universal now, that you should get a baseline colonoscopy at age 45. Previously, we'd said African Americans at age 45 because it's more common. But everybody at age 45. Now, if you have a first-degree relative that's had colon cancer, you need to be screened 15 years before they were diagnosed. So in other words, if they were diagnosed at age 50, you should get a screening colonoscopy at age 35. That's important. And remember, family history is important with all these cancers, but it's not the primary risk factor. The primary risk factor is your lifestyle. Remember that. So about 10, maybe 15% risk goes to family history. The rest of it's your lifestyle. Think about colon cancer. That's so important. I've seen so many needless deaths from colon cancer when they could have gotten a screening colonoscopy, found a polyp. It almost always starts with a small polyp, progresses to a large polyp, then it's cancer. So if they can snip that polyp out early, you can prevent dying from this. Very important. Colon cancer is a killer. And it's, to me, the number one preventable type of cancer just with screening. So you need to think about that. Certainly, other people are increased risk of colon cancer, including people who've had a lot of bowel problems like Crohn's or ulcerative colitis. They need it a lot earlier, a colonoscopy a lot earlier. And again, colonoscopy is the gold standard. There's other screening tests like a yearly fecal guaiac test, which is just a stool smear, and they pour a chemical on it. And when you can't see the blood, it will detect blood. So that's a yearly thing that you should do after 40 for sure. There's also a new DNA stool test. Most people know it as a Cologuard test. That's an acceptable thing to do if you just can't or won't get a colonoscopy. Or maybe if you've had a normal baseline colonoscopy without any risk factors, it may be reasonable to do a Cologuard stool test every 3 years. Certainly a lot more often than a colonoscopy. If you have a completely clean colonoscopy and you have no family history, they didn't find any polyps, you can probably safely do that just every 10 years. So think about these different ways that you can do it. Certainly the colonoscopy is a gold standard, and I recommend it for everybody. Let's talk about breast cancer a little bit. And this is controversial. It's besides non-melanoma skin cancer, it's the number one diagnosed cancer in the United States. And, I talked to a lot of people, a lot of experts on breast cancer. Happen to have a very close relative who is a breast cancer surgeon. That's all she does. And we were talking recently, and she strongly feels, and I agree with her, that you should get a baseline mammogram at age 30. That is sooner than most of the recommendations by the cancer societies. But we're seeing more and more young women in their 20s get breast cancer. It's sneaky in a young age. It's a lot more deadly and fast growing if you get it at a young age. And we're seeing more of it, I think, because of lifestyle, obesity, exposure to a lot of chemicals, pesticides, hormones in your foods, etc. Poultry is a major offender. All the hormones they pump into these chickens is especially bad, I think. But I think you should get a baseline at 30 and then 35 and then annually after age 40. And remember, this is a 3D tomogram, not just a digital, but a 3D tomogram. There are also MRIs coming in there too, but make sure it's a 3D. Even men can get breast cancer. 1 in 100 diagnosed breast cancer is in men. And in men, it's a lot more deadly than women. Average man after diagnosis lives 6 years. Woman, early detection, 15 years. So in men, certainly, although only 4,500 men die of male breast cancer per year. But if you notice something, there's no screening for that except noticing changes like a hard knot or a change in your breast or pain in their discharge or induration of the skin. So men, check your breast as well. Most of the women that I've seen that walk into my office with breast cancer have self-diagnosed it themselves. They feel a change, so you always follow that up. And if men feel a lump, I'd automatically get a bilateral mammogram and a diagnostic ultrasound on the side that you feel the lump in. So men don't ignore that because it is more aggressive in men, but, still pretty rare. But women, breast cancer screening is very important. And now they can, serotype it, DNA type it. There's a lot of great treatments for breast cancer now. It's really a lot more curable than it was, when I first got out of medical school 35, 40 years ago. So breast cancer, be very aware of it. Maybe the most important screening thing behind colonoscopy that you can do. I would say definitely. The last one I want to focus on is prostate cancer screening. Again, June is Men's Health Month, and it's very important that men be screened for prostate cancer. It's the second leading cause for men of cancer deaths. I think you ought to have a yearly rectal and prostate exam after age 40. Certainly sooner if you notice anything different. Certainly if you start to have prostate problems, infections, or urinary hesitancy, of course, urine in the blood, or any kind of symptom there that needs to be checked out. And the PSA, which is kind of highly controversial, it's not a great test because a lot of times it can go up and down based on infection, enlarged prostate, etc. So it can kind of scare you too much. So if you get a slightly elevated PSA, do not freak out. It just needs to be checked and followed. A lot of people think, 0 to 4, you're normal. Well, it's really the velocity that the PSA goes up every year is the important thing. Certainly, I've had a lot of experience with prostates through the years, and you can't be 66 years old without having some prostate problems. And so keep an eye on that. Certainly need a prostate check after age 40. And I think yearly, and I think you should have a yearly PSA as well. It's not a perfect test, but it's a good kind of perk your ears up thing that something's going on with your prostate, either prostatitis, enlarged prostate, and it could be prostate cancer. You certainly need to rule that out. African American men need to be screened certainly a little bit earlier. It's more common, maybe by age 45. Maybe if you're really low risk, for sure at 50, you need to start screening with the the PSAs and digital exams. I've seen guys that have prostate cancer with PSA of 1, but with a prostate knot that we found. And I've followed men with a PSA of 18 with no prostate cancer. And we've got a great new tool for screening prostate cancer if we get a little suspicious, and that's an MRI of your prostate. Certainly a lot easier and less invasive than a biopsy, just because your PSA's increased. So you need to think that out before you willy-nilly go getting a prostate biopsy. That's a painful thing, and there's a better way to do it. Remember, prostate cancer are very slow-growing cancers, and you need to realize that and not get freaked out by a slightly elevated PSA. Always get that checked out. There's the new MRI that we're doing. We can even do it now here in the Tri-Cities. I used to have to send all the men to either Chattanooga or Atlanta. And so there's a lot of different treatments too for prostate cancer. And we've done podcasts on that before, and certainly, you should come in and discuss it with somebody who's a non-biased person, as far as like me, they've seen all the different forms of treatment and can hopefully give you some good recommendations, because there's several different treatments for that. But so prostate cancer certainly needs to be screened for in men. So I hope that you'll take this for what it's worth, and it's very important. If your first note is, please live a healthy lifestyle. You want to prevent cancer by living a healthy lifestyle, and getting the proper screening exams at the right time in your life. And hopefully you'll live a long, healthy life without cancer. So it's been Dr. Rogers at Performance Medicine, the Common Sense MD. I hope next week we can talk again with some common sense things for your health. I'll see you next week.